Name the primary stress hormone. Cortisol. Is it the only hormone that's released during stress? But of course not. It's just the one we consider the main stress hormone. That would be cortisol. Cortisol is released from which gland? The adrenal. Which part? Adrenal cortex. Which region of the cortex? Zona fasciculata, which may have appeared on the lab test. Cortisol is considered a glucocorticoid. I'm going to go fast on this because we have it in our notes. It's a glucocorticoid because it's a cortical steroid. All steroids from the adrenal cortex are called corticoids. It's called gluco because it regulates blood sugar. All right? It does a whole lot more than that, but that's why they call it a glucocorticoid. Remember, regulate is kind of a base level baby understanding because regulate never tells us up or down. Regulate just tells us deals with. And we have hormones that regulate things that make them go up and make them go down. And regulate is what a generic person on the street might know, right? Insulin regulates blood sugar, but they don't necessarily know which way it takes it. In A&P, we don't really want to use the term regulate much on tests because we want specific knowledge, all right? By the way, cortisol regulates it which way? Makes blood sugar go up. Under stress, we save it for the brain. Blood sugar goes up, and I'm not sure if I gave you this yet, but I probably did. Remember gluconeogenesis. What is that? Formation of a new sugar molecule that comes from what? Fatty acids and amino acids, or you could say fats and proteins. Very good. Enough of that. We'll just look at a lady that has high levels of cortisol. She has a disease that's called Cushing syndrome. That's high cortisol. This is what she looked like before the disease, and this is what she looked like after she had the disease. Well, I don't know how long it took in this case, to be honest with you. 12 hours, actually. No, it's not instant. It comes on over a period of months or maybe even years. Could have. But this is probably months, maybe, but not, it's not that many years later, to be honest with you. Anything. Next region of the adrenal cortex is the zona reticularis. Very good. Since it's adrenal cortex, its hormones are called corticoids. Which kind? Gonado. Tell me what that means. Affects the gonads. Very good. Now you notice I'm kicking it up a notch. I'm going faster. It's not just because we had a snow day. It's because we've already tested in lab over this. It should be in your head better. Okay? If you need to slow me down, you can on Integrity. You can pause whenever you want. I bet some of you listen to it and you put it up to 2x. And it sounds like I'm talking like this all the time, even though I'm not talking like this. My voice is like this, and everybody like that. You're like, right on, I got it. Then others of you slow it down to have. All right. The zona reticularis secretes chemicals called androgens. Yes, they are hormones. They masculinize. That's what we typically say. They're masculinizing hormones. So if you're a woman and your androgens go up, you probably will get a little mustache. Okay? Or maybe some nice, cute hairs on your back. Or a beard. Or huge biceps. Because that's what it does. It causes these things to happen. So let me ask you a little question. Androgens. Well, let me tell you something first. One of the main ones is called this right here. Sorry, it's at the bottom. I know it's hard for you to see in some places. Androstenedione is one of the main androgens. I want you to know it. It's the only one I want you to know by name. We have not mentioned that yet. This is new information. Androstenedione. How many people remember the great home run race in Major League Baseball? How many home runs were those guys hitting? Not 70. Around 70, right? They went from 45 to 70 in 1 year. But they weren't doing steroids, were they? Well, here's the deal. Mark McGuire said, I'm not taking steroids. I'm taking a supplement that my trainer gave me. It's called Andro. Hey, what did I just talk about? Androstenedione. That's what he was taking. Anybody that knew organic chemistry knew when he said andro that he was taking a cortical steroid from the adrenal cortex. That is not testosterone. It's not the steroids that come from your testes. But look right here. Converted to what? Testosterone. So was he on the juice? Yeah, he was. He finally admitted it. Okay. Maybe at the time he didn't know. I'm guessing he probably did know. Yeah, onset of puberty, secondary sexual characteristics like body hair and muscle mass, and sex drive. It was very tough for me not to make a joke there. All right. So the adrenal medulla is the next gland. I love doing the medulla of the adrenal gland because you already have some mental hooks for this. This is something that everybody's familiar with in one way or another. Do you know how you're familiar with it already? Even before anatomy and physiology class? The chemicals from this gland are commonly referred to as adrenaline. Everybody thinks something when you hear adrenaline. What do you think? Increased something. Increased heart rate, increased strength. Mom lifts the car off of her baby because of adrenaline, right? You ever heard of that happening? Mom picking up a car with one arm, you know. Maybe not the whole car, but picking it up and pulling the baby out. They've had that happen because of these hormones right here. Crazy, crazy. It's not always that heightened, but it can be. So these hormones that we're seeing, weren't they talked about in AMP1 as neurotransmitters? Do you remember that? Norepinephrine, major neurotransmitter, right? How in the world can these hormones from the adrenal medulla also be neurotransmitters? Because Josh got it. It's made up of nerve tissue. The adrenal medulla is made up of nerve tissue. However, it secretes into the blood. So even though it's making the same chemicals that other nerve tissue makes, they're now called hormones because they travel through the blood. Okay, what do? Generically, they do these things. Heart beats faster, blood vessels constrict, blood sugar goes up, blood goes to important areas, but I'm going to give you more specific than just that. And this is how we're going to do it. I need everybody to write that word down. Fight or flight goes with the sympathetic nervous system. And when fight or flight kicks in and the sympathetic nervous system kicks in, it causes the adrenal medulla to dump these hormones as well. When you talked about the autonomic nervous system, you should have talked about fight or flight. And these are the things that would happen. So let me give you some of the things. They're not all on this. I just turned the page so you wouldn't stay on the same. Here's how I always do it. When I'm talking about the sympathetic nervous system in class, I usually say something like this. What would happen in your body right now if through that door came a bear? Yeah. Maria, you're not participating because, dear, he just gobbled you up. Sorry. But in all the rest of our bodies, our heart rate goes through the roof. Why? It's AMP2, it's a different level of knowledge. You got to know the why. Not because of epinephrine and norepinephrine. I mean, that's the why, but what's the cause? What's the purpose? What are we achieving? To get? Give me, okay, say it again. Okay. If the bear is there, you have two choices. That's why they call it fight or flight. You can beat the bear down. I heard you. All right. Or you can throw your neighbor to the bear, or you can run away from the bear. Right? Now's a good time for me to tell you, that door's locked. Those windows are barred shut. Okay? So the bear's eating somebody. Our blood levels go up, or our heart beats faster to pump more stuff to the cells that need it, to your muscle and to other things. So your heart beats faster to get oxygen and sugar and sodium and potassium and calcium and all that stuff to the muscle so that you can fight or run. Either way, you got to use your muscles, right? Okay, what happens to the lungs or the breathing rate? Tell me why it goes up. What good does it do to pump blood to the tissue if there's no oxygen in it? You have to take more breaths. You have to take deeper breaths. Because your heart is pumping so fast, you need to replace the oxygen quickly. Those two, that's why we typically see cardio and respiratory go hand in hand. When somebody's heart rate's up, their breathing rate's usually up. All right. Next step. So we know what it does to respiratory and cardiovascular. By the way, it's not just that it beats faster, that you breathe faster. It beats stronger, and you breathe more deeply as well. So every time it beats, it pushes more. Every time you breathe, you pull in more. What happens to your guts? They shut down. They shut down. What does that mean? Not just that. Not just you're not hungry. I'm going to say it more specifically. What were you saying? What were you saying? Okay. Here's what it means. It means it quits moving. The contractions that happen in there that we haven't talked about much, they slow down. The blood flow to the guts goes away. So what's that called when blood flow decreases? Look right here's the word. Vasoconstriction. All through the digestive tract, vasoconstriction occurs. And your gut is not secreting its chemicals, its digestive chemicals. Why are we not secreting? Why have we taken the blood flow away? And why are the guts not moving much? Good, good, good. Make it more real, right in the moment. Staying alive is pretty in the moment, though. Okay, you are correct. The blood that normally goes there is going other places, but why can we choose to steal it from the gut? Why can we shut down? Why don't we need it? But you might live. Okay, here's the point. You need energy now. You cannot go, yo bear. Big Mac has to digest. Give me about 4 hours, and then I'm going to whoop you. You don't have the opportunity to do that. You need it now. So what happens? Your liver dumps sugar out. What's that called when the big molecule's broken down by the liver and sugar's dumped into your blood? By the way, I put this slide up for a reason. It's got the words on it for you. Glycogenolysis occurs. Glycogen is broken down in the liver, converted into sugar, and pushed into the blood. It goes to your body cells. You're not waiting to digest the Big Mac for energy, for sugar. You're using what's already readily available in just a few seconds. That's cool. So your digestive tract can shut down. So you know what that means? When you're under stress, no matter what the stress, like an AMP2 lab test, and you start to dump a little cortisol, what happens to your digestive tract? It slows down. Do Americans have a very stress-free life usually? Do students that are taking a night class because they have a life, and maybe they have a family or a significant other or kids or job or all of the above and then some, and maybe they have bills to pay at the same time, or maybe they just have mom and dad on their case. I mean, you never know. Every stress is a stress to somebody, right? So we got all that stuff going on. And you know how it goes. You get off work late and you got to come to class and you got a test and you don't have time to study. Stress kicks in right there. And then You eat. Imagine every day you're eating and you're under stress. How good do you digest, how well do you digest the food when your system is shut down? Do stressed people have a lot of digestive problems? Why, yes, they do. Digestive problems are amazingly crazy in America. Why? This is one of the main reasons right here. And it's not just this, it's cortisol too. Okay? Hey, remember, cortisol, which is also under stress, causes you to store fat where? In your belly. Well, it causes you to burn other fats. That's insane. Burns fat for energy, but not belly fat. Makes you put it there. Save it for a rainy day. All right, back to epi and norepi. So we know the gut. What happens to the muscles? What happens to blood flow in the muscles? In the muscles? Vasodilation. You need more flow to your muscles, right? So that you can have more sugar and more oxygen to make more ATP to beat on the bear more. That's the whole point. What happens in your skin? May, but this is more important. The blood flow constricts. Why? There's a great chance you're going to get cut. Theoretically, if you're under fight or flight, when a caveman was under fight or flight, it's because there was something chasing him, typically. It wasn't because he couldn't find the remote, okay? There were other reasons. So odds are he's going to be getting in a fight with something or getting away from something and running into some shrubs and bushes and trees and cutting himself. We don't want to bleed to death from all those thousands of little cuts. We take the blood out of our skin. Wow. We put it into our core. What this also means is when you're under stress, you get skin problems because the skin is clean from the blood below. And you take that blood flow away, and you start getting pimples. Golly, it's all connected. It's all connected. The last one that I'll do, I guess, we'll stop. Maybe a couple. The eyes do what? Pupils dilate to take in more light. And I don't know, what happens to the urine that's in your body at that moment? Truth be told, just like the digestive tract, your urinary tract shuts down. Some people, their sphincters open. Other people, they close. Some people get scared and they don't leak a drop. Other people get scared and the whole enchilada comes out. All right? So that's the adrenal medulla. That's fight or flight. That's epi and norepi. By the way, when that happens, is your heart rate up for 20 days? No. This is short term, right? This is shorter term. Why? Because it's non-steroids. Yeah, I heard that. Yeah. Because it's a non-steroid, they're cleared from the blood quickly. If something like that happened, within 20, 30 minutes, most of our heart rates would be pretty close to normal. All right? Unless we care about Maria, then we'd be sad and our heart rates would be still up. So we can move along. That's a cool slide. You may want to check it out on your own time. Pineal gland makes melatonin. Did we happen to cover it in our class? So check this out. There's a syndrome called seasonal affective disorder. What do the first letters spell? SAD. Also known as the winter blues. How many people ever lived up in the Pacific Northwest somewhere? Tell me, what's an average day look like? What color? Gray. And what's the rain like up there? Is it big drops like down here? Just enough to get your glasses wet, right? Like this little misty thing. We wouldn't even probably call it rain. Mm-hmm. Crazy. However, they say that, like Seattle, gets 60 sunny days a year. If you look it up on the weather, it'll say 60 sunny days. How many do we get? 300. We have over 300 sunny days a year typically. How do you feel when you have 3 days of not much sun like we did last week? Yeah, some people love it. But what if you have to get up at 6 in the morning every day and start your day? It is for you? It's easier? It's more difficult usually. Renee, that's not right. Tell me about this hormone. When's it dumped into your blood? When it's dark. That would typically be at night, but depending on where you live and what's going on, maybe not. So if cold fronts move in, or if you live in Seattle, or Portland or something, and you get a lot of that gray stuff going on, you may get what's called the winter blues. It's more common in the winter because it stays gray all the time up there. And higher rates of suicide than anywhere, down south. Because of this. You know how they treat it? You're sure not going to give melatonin. You're going to treat it, Andy, with light. You're right. You treat it with light therapy. They have little goggles you can wear for just a few minutes. And it stimulates your pineal gland and shuts it off. How? How does that work? Here's how it works. The light shuts off the pineal gland. Every morning when the sun comes up, oh, this is so cool. I haven't said this in a while. Do you know that you have sensors from light on the thin skin behind your knee? That's great. Yeah? That's kind of crazy, right? Your eyes don't have to be open to know there's light, but notice your eyelids are thin, right? So even if you're asleep, your eyes are aware that it gets lighter. Or if you cover your head and your legs sticking out of the cover, you might know it too. And this is the deal. The optic nerve is vision. But on its way back to the occipital lobe where you see things, it has little branches that go to the pineal gland. So when it's daylight, the pineal knows it, and the pineal's taking its little nap. And then when it gets dark, it starts to pump up its melatonin production. And it causes an average person to get sleepy. Some of you guys are wired freaky and you're night owls and all kinds of crazy stuff, and I don't want to know about it. But anyway, so that's this. It's kind of crazy. What happens if you have to get up every day and you're tired? Would you be a happy, perky individual? Or might you be a little more grumpy? Yeah. So up in the Pacific Northwest, there was a type of music that got started up there. What was it called? Grunge. What was the mood of grunge? It was a little darker than gray. It perfectly fit this syndrome. Dark, depressed, angst-ridden, all that. Almost suicidal, or at least angry. Okay. And yeah, some of it was. So that moves us right into the pancreas, which is going to be so easy for us because we've already done this. So we can whip right through the pancreas, and we'll be done with this chapter pretty quickly, to be honest with you. Except we have to spend an hour on diabetes. So, pancreas has both endocrine and exocrine. Both endocrine and exocrine tissue. That means it has a couple different types of glands. What does the endocrine part do? Right, makes hormones. And you were so specific, you said insulin and glucagon, which is great. What's the endocrine portion called? Islets of Langerhans. You think Langerhans was born in Texas? Doubtful. No, was not. No, it's not. Texas wasn't even around back then. Okay. So, the exocrine portion, what do you know from your lab test? That's called the pancreatic acini, and what does it make? Digestive enzymes. Now, we will take this one step deeper. The islets of Langerhans contain two cell types. They're called alpha cells and beta cells. Look at this slide. We do not see this on our slides because they're not stained the same. Kind of a little tough for you to see up there, but maybe not. Can you tell that some of these cells are pink and some are blue? Or is that not showing up there? It's showing up. See the pink ones here. Those cells are called alpha cells, and they make glucagon. I do need you to be aware of that. The insulin-producing cells are the bluer ones. Those are called the beta cells. So we have alpha cells and beta cells. Look, it says it right here. We know that insulin and glucagon regulate blood sugar, and we know that saying regulate is a cop-out. It means we don't necessarily know which way it's taking it. We have to know which way it takes it, and we have to own it. Yes. Why are we starting with insulin? Because we know something about it, and we want to start somewhere we know. We already have that mental Velcro because we've heard the word in our lives, and we associate it with what disease? Diabetes, which we'll talk about in just a little bit. If you haven't learned this yet, now's the time to start locking it in. Insulin lowers your blood sugar. But this is lecture. We have to take it further. Why is insulin released into your blood? When your blood sugar goes up, insulin is released to take the sugar out of your blood and give it to your body cells. See, insulin opens sugar channels on your cells. Which cells specifically do we mention right up there? Fat and muscle cells. Those aren't the only cells. You know, we're just kind of telling you that. Hey, do you know what fat cells do with the sugar? And they store it in what form? Fat. What a shock. Fat cells convert sugar into triglycerides, into fat, and they store it. Man, we're going to talk about how evil sugar is. You know, they're showing now that sugar is eviler than fat, that a diet that's high in sugar does all kinds of bad things. It actually constricts your blood vessels and drives up your blood pressure and just messes with everything, which is sad because sugar really tastes good. This next bullet, I don't focus on that much. But this right here, I just want to reiterate these words. These two things, before you try to memorize them specifically, glycogenolysis and gluconeogenesis are both there. Those processes raise blood sugar. So let me ask you a question. If insulin is lowering blood sugar, does it want to kick these, thank you dear, kick these processes off, or does it want to stop them? Right? Those processes that raise blood sugar, insulin would tell those processes to not occur. That's why you see right here, inhibits both glycogenolysis and gluconeogenesis. Now remember what we're trying to do. We're trying to own insulin. If we own insulin, then that would tell us automatically that glucagon would do what with those two processes? It would turn them on, okay? So see how we do it? We own one, and then the other's the opposite. The other must raise blood sugar by doing those two things. I don't get that particular on it, okay? We did mention this. That's what I really wanted you to see here, was that last bullet. Adipose tissue converts sugar into fat. So we'll go back and mention glucagon. Glucagon is there to elevate your blood sugar. But hey, this is lecture and it's AMP2, so we need to take it to a deeper level. Why would glucagon be released? Let's say that you skipped a meal today on your way in here because you wanted to study. Raise your hand if you did that. Woof. Okay, couple things happened there. Oh boy. So your blood sugar level, if you didn't eat it all, now if you chugged a soda or drank some frappuccino-ish beverage, your blood sugar went up. But if you didn't have anything, your blood sugar goes down. But you have glycogen stored in your liver. And you have fatty acids and amino acids, and your body can convert all of that into glucose and raise the blood sugar with this hormone. So this is released when it's been a while since you ate or when your blood sugar is low. And it's released in order to raise your blood sugar up. That's why we can get away with that and do that. Unless we're diabetic, then you need to keep levels level and not let them fluctuate, and that means eat regularly, not skip meals. It's very bad to skip meals if you're diabetic. We'll talk about why and what and everything in a little bit. Make sure you own the difference between these two. You know, I've been telling you already. I hammer you on the G words on this test. Glucose and glycogen and glucagon and gluconeogenesis and glycogenolysis. You have to own the difference between them. You have to be able to define each of them for me. Okay? What's glucose? It's sugar. It's a simple sugar. It's commonly your sugar that's in the blood, too. What's glucagon? Pancreatic hormone that raises blood sugar. What's glycogen? Stored form of sugar, which is a large chain of sugars. It's technically a polysaccharide. So it's a long chain of sugars, typically stored. Long chain of sugars, typically stored. Glycogenolysis then is the breakdown of that molecule of glycogen. And it breaks it down into what? Glucose. And then gluconeogenesis is the production of sugar from non-carbohydrate sources like fatty acids and amino acids. I know maybe you didn't get all that down right there. We've done all those processes at some time, so you have them in your notes. First things first, the word diabetes means to flow through. To flow through. Now, this disease is not just called diabetes, even though that's all we usually say. Hey, if you know people from, generations that are a little bit older than the average person in here, they usually say blank diabetes. No, do you know what they say? You know what they call it? Like my grandma? They call it sugar diabetes. You ever heard that? That's what they used to call it. Because there's diabetes insipidus that we've talked about that has nothing to do with sugar, and it's a diabetes. And I guess that was common when it first came up, and they started realizing that they used to always call this sugar diabetes. All right? Now we call it diabetes mellitus, which means to flow through like honey. Like honey. Oh, my. If it's flowing through, where are you finding this? That means urine. What does to flow through like honey mean? Okay, but no. It doesn't. Good try. It means it's got a lot of sugar in your urine. So if you were a doctor in 1890, you know how you diagnosed diabetes? You tasted some pee. And if it was sweet, I gotta ask, what was said there? Wow. Can you imagine who wants to be a doctor in 1890? Raise your hand. I'm just curious where my freaky people are in this class. So diabetes mellitus, we now know to flow through like honey. That means that glucose ends up in your urine. This is one time we can say normally there should be no sugar in your urine. Lots of times we say, oh, there's a little bit, that's okay. Sugar in the urine, not okay. It means something's wrong. It doesn't mean you have this, but it means something's wrong. If you ate a whole box of Twinkies at one sitting, your blood sugar would get too high, and some sugar would probably spill over into your urine too. But it wouldn't be like that all the time, unless you ate Twinkies every day, and then you would eventually get this, and then it would be all the time. So there you have it. Let's look at the kidney. This is a little interior view of a kidney. Here's a capillary, and this is from AMP1. This is a tube in the kidney called a kidney tubule. What kind of tissue is that? That is simple cuboidal epithelium. You may remember the tubes in the kidneys are made of simple cuboidal, but there's also capillaries that are just regular old simple squamous. What's the point here? Here's the point. what the kidney does is decides what the blood needs and doesn't need. What it doesn't need becomes urine. Okay? The kidney knows that your body uses sugar for energy. The kidney knows that sugar is important. So it usually puts it all where? All of it usually goes back into the blood. However, sometimes when there's too much sugar, that says blood sugar in case you can't read it right there. When there's elevated blood sugar, the sugar can get so high that your kidneys can't put it any more in. There's too much in the blood already. So what happens? The sugar starts to fall over into these tubules, and as it passes through, it ends up in your urine. All right? With excessively high sugar, your kidney just can't put any more in the blood. And they say it spills over into the urine. That's why I wrote that phrase right there. It spills over into urine. Well, there happens to be two types of diabetes. There's type 1 and type 2. Type 1 is the kind that kids used to get. When a kid was 6 years old or 8 years old and they'd have to start taking insulin, it was type 1 diabetes. And type 1 diabetes, like I said, the kids have to take insulin shots. So it is now called insulin-dependent diabetes mellitus. That's what IDDM is. There is a great homeostatic imbalance on this in your book, and there's also one of those closer looks or clinical connections that is a whole page about diabetes as well. I'm telling you most of it, but I still want you to read it. It will spell this out for you. Insulin-dependent. Why is it type 1 called that? They have to take it. By the way, did they swallow insulin pills? No, they take shots because your gut will change it. Not a shot like that. Good point. You take a shot. You get a shot right in the gluteus. No. Where? Oh, your little abdomen. Oh. Oh, yeah. Yeah, well, okay. Let me mention this. Can you maybe ask it in a minute because it'll become more relevant in just a second. Why are they taking insulin? Because the body is no longer producing it in normal levels. It has a decreased production. From where? Islets of Langerhans. Which cells? Beta. The beta cells. See, this disease that we know about is an autoimmune condition. Okay, the jury's still out on why it happens. They're starting to figure out lots of cool things about it, though. But really, it's when your body's immune system decides that, the beta cells are bad. There's something on them that's foreign, or not me, or just wrong with them, and I need to kill them. And so it destroys them, and your body produces less insulin, less insulin, less insulin. Well, when do you need insulin, and why do you need insulin? You typically need it, not just when it's too high, but you need it after a meal because your blood sugar goes up. And the whole point is to get sugar into what? But into the cells, right? To get it into the cells to use it for energy. So therefore, no insulin, no sugar in. And really, it's not always no insulin, no sugar. It's low insulin, low sugar, low energy. What happens is the cells starve. Your whole body, your cells start to starve because they want sugar for energy. So remember, what happens? We get elevated blood sugar with this type of diabetes. Why? Because they have low insulin. The pancreas has been destroyed, parts of it. Type 2 diabetes, usually seen with adults. Now known as non-insulin dependent because these people don't need to take shots of insulin. This we hinted at earlier in the semester, a couple weeks ago. We said that there was something called downregulation. See, the typical type 2 diabetic is right here. I apologize. This is how they've just been teaching it for years. This doesn't mean that it's just that. It's a memory device. What are the 3 F's? The common, typical person that has adult onset diabetes, which type 2 is called. By the way, type 1 is called juvenile. That's why kids get it. Those are alternate names. They used to call it juvenile and adult onset, then type 1 and type 2. Now it's insulin dependent versus non-insulin dependent. 3 F's stand for fat, female, and 40. Fat, female, and 40. How horrible is that? It should have said sexy, single, and 60, right? SSS, but it didn't. Okay. Oh. So here's the deal. Why overweight? Why female and why 40? Who knows? Right? Now we kind of know. Here's what happens. When you get over 40, your hormone levels start to change. Okay? Just because you're overweight, it doesn't mean it's for this reason, or it doesn't mean that it's going to lead to this. Here's the deal. This is not a blame game on anybody. The point is, we don't know our genetics. You know? Some people look at a piece of pie and gain 5 pounds. Some people eat 20 pies and don't gain an ounce. Some people can binge on sugar every day and never get diabetes because of their genetics. You don't know if you're that person. All right? Tends to be that people that are more prone to this tend to crave sugar, which is horrible. Because then they want to eat that thing which their body's not processing well, and their cells eventually go, I don't want any more, so downregulation occurs. It shuts off the receptor number. No new receptors. Receptors die off. They don't get replaced. Let me ask you a question. If you have fewer receptors, is the insulin effective? So, check this out. Once again, if you have fewer receptors, is the insulin effective? No. So whether you have low insulin or low receptors, you get the same problems. And that's what I'm getting to. Type 1 and type 2 have the same problems. They just happen for a different reason. Low insulin versus low receptors. Okay? But then we get to this whole point. Well, I'll mention this. Diet and exercise, phenomenal for both types. Actually, it's so good for type 2 that some people can, I hate to use this word, but I will, can cure type 2 diabetes with their diet and exercise. There have been people that were type 2 diabetics that, because of their genetics and everything, when they exercise and if they change their diet, that it goes away. Wow, that is cool. You don't really see that with type 1 diabetes because it's an autoimmune condition. It will still help. It will help to manage the symptoms. Exercise is amazing for your body, for the way that your body does things. And what can happen is when you get less sugar and when you exercise, your cells can start to say, oh, maybe I want the sugar again. And they can start putting receptors back there, and the sugar can get in, especially to your muscle, because when you exercise, it makes your muscle hungry. That's cool. Is that going to work and fix this problem for everybody? No, but it can. So it's a good thing to try. Here's the other point. You've got to keep your sugar levels constant and consistent, no matter which type you have. Why can sugar spike? Because it's regulated by non-steroids, which are water-soluble, which travel in the free form, which allow levels to rise and fall quickly. That's why it spikes. You don't want that. So a diabetic, no matter if you're type 1 or type 2, you want to eat many meals, 6 meals a day, little small meals. You can have complex carbohydrates, but you better not have much sugar at all. And you want protein as well, because that levels the blood sugar, which is why some people need an insulin pump. Here's what they figured out. Years ago, when someone was diabetic, they used to give them one shot in the morning, one big old shot of insulin. Do we eat once a day? So then they figured out maybe 3 shots a day, maybe one before every meal to help level it. And then there's this book called The Diabetes Solution. You should write that down if you know somebody that's diabetic. How many people in here do not know a diabetic? Just curious. Didn't I ask the class before? Didn't I say it's been 5 years? Doggone day class ruined it for me. 2 people in there said, oh, no, a diabetic. They just don't know that they know a diabetic, and that's what I told them. But now I can't say it's been 5 years anymore. That really bums me out. But anyway. Okay, we're regulating. The book, Diabetes Solution, this guy became a doctor because he had juvenile diabetes and got fascinated with diabetes and got his medical degree just so he could help people learn to manage diabetes. And he's all about multiple meals, more of a grazer, low sugar, and it's amazing what that does for people, you know. Atkins diet and Zone diet and stuff like that is kind of good for diabetics because it keeps your sugar levels consistent. And that's what the pump is. It just gives the insulin more frequently, and so it helps to level them. We've got to look at this other slide, though. Because here is what can happen regardless of which type you have. Boy, are you ready for this? The most obvious symptoms are the 3 Ps. Polyuria, polydipsia, and polyphagia. And I'm sorry I only have a couple minutes, so I'm going to go kind of fast. All right? You can pause Tegrity later and listen to it again. And we'll say that a lot in your little life, probably. Polyuria means you go a lot. Polydipsia means you are thirsty because of that. And polyphagia means you're hungry. Why are diabetics hungry? Because their body cells are starving no matter how much sugar is there. Your cells are hungry because they need ATP. That's what makes us hungry, is when our cells need energy. So the crazy thing is, when you're a diabetic, you crave sugar, so you get hungry, and man, you want to eat whatever you love to eat, like pasta or bread or pie or cake or donuts or Snickers bars. Oh my goodness, are you feeling it, anybody? There's yum, 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 right? Oh wow, I'm 40 days Frappuccino free. Yay, me. Okay, so back to this. You're starving because your body wants energy. Why are you going to the bathroom a lot? Sugar's in the urine, sugar's a solute, so what follows it? Water. Water follows. By the way, since sugar's a solute and there's extra sugar in the blood, your blood pressure could also go up. Wow, you make more urine and your blood pressure's up. That's crazy because there's no sugar in the cells, so your cells can give up a little of the water so they can dehydrate a little. That's not real good for your cells, is it? Okay. And we know the spills over and the increased sugar in the urine. We understand that. We understand this. So here's where we can go to all this crazy stuff down here. Diabetics commonly get neuropathies. That means 2 things. At first, it can mean significant pain. They just get these pains from the nerves. Neurons are dying off, and they start to send all kinds of crazy signals, like, ow, this hurts. But then, on the other end of the spectrum, they can also lose sensation. So a diabetic walks outside, steps on a nail, doesn't even know it. Walks through the grass, gets all kinds of yucky stuff in the cut. Now they have just got an infection. Let me ask you, how do infections heal in diabetics? Really quickly? Why? Do you know why they heal so slowly? They can commonly have poor circulation. That's part of it. Here's another thing to think of. When your blood sugar is up, does the sugar just stay in the blood? Even though your cells can't get it in, it moves out of the capillaries, it goes into the tissues to try to go to the cells, but it can't get in. So your tissues become sugary. They become what are called glycosated. It gets all sticky and nasty in there. Do some bacteria love to feast on sugar? So therefore, the infection can go crazy. in there. All right? Now, when you get an infection there, eventually areas can start to die. There's poor wound healing, gangrene can set in, and what has to happen? Amputations. Have you ever heard, this is horrible, that somebody wanted to save their foot or their leg, so they cut their foot off, you know? The doctors took their foot. Then they found out, oh, it's too late. It was spread up into the leg. So then they take the leg at the knee, and guess what? It was too late. It was already in the thigh. They finally take the whole leg. It was already in the torso. Now it's too late. Horrible that that happens, but sometimes that happens. Nobody wants to lose a limb, but you know, if they take it slow enough, it can wind up costing somebody their life. Let me just ask you, what's more serious? Neuropathies, gangrene, or I gotta pee? Okay, which one's the least serious? That's what I mean. I gotta pee. What's the least serious? Gangrene, neuropathy, or I'm hungry. I'm hungry. Do you get my drift? Those 3 P's up there, while they're the cardinal signs, they're not the most serious. They're the nothings that help people to diagnose it, though. Okay? Commonly for a diabetic, especially a type 1, to have a massive weight loss right when they get diabetes. Do you know why? Type 2, not so much, but type 1, common. The cells are starving. They're not getting the calories. You can eat as much sugar as you want, and it doesn't go into the cell, so there's no metabolic rate for that. So let's say you ate 2,000 calories and 1,000 are sugars. They just pass through the body, and it's like you only ate a 1,000-calorie diet, so you start to lose weight. That's a lot of people get diagnosed with diabetes when all of a sudden they have this weight loss that scares them. They go to the doctor. They think they have cancer. It's like, oh, you have diabetes. Comparatively, that's good news, you know. Also, diabetics commonly notice they have to take water with them to bed because they urinate at night so much that they need to replace it. That's an early warning symptom of diabetes as well. Diabetes, you start burning fats and proteins instead of sugar. When you're burning fats, you get these little things in your blood called ketones. We'll talk about more in the digestive system. Ketones are acids. You need to know, this is the first time we're saying it in AMP2, we're going to focus on this all through the semester. An acidic pH is a lower pH. All right? Your blood level, which we'll say in the next talk tomorrow night too, of pH is usually 7.35 to 7.45. That's the measurement of pH, concentration of hydrogen ions. When we say that a diabetic gets more of these and their blood becomes acidic, we mean it moves this way, lower than 7.35. We don't mean it moves to 2 or 3 or 5 or even 6, just lower than 7.35. That's called diabetic ketoacidosis. You may have heard that leads to confusion, disorientation, and diabetics can even go into a coma and die from that. When you get increased fat in the blood, that can lead to cardiovascular problems, but check this out. High blood sugar has now been shown to cause blood vessels to constrict. Wow, sugar in the blood makes them constrict. What's that do to your blood pressure? It goes up. That's hard on your heart. Sugar also causes inflammation of blood vessels. Not only do they constrict, but they get inflamed. I don't know if you know or not, but in order to lay a plaque down in a blood vessel, it has to be inflamed first. And sugar's the main culprit, not fat. We usually think of plaquing in arteries all about fat in the diet. It's not. It's mostly about sugar in the diet. We're starting to learn more, right? All those years ago, it was, oh, your fat levels are bad, your fat levels are bad. People quit eating fat. They keep eating sugar, and it doesn't change it so much. It's horrible. Retinopathy is when the neurons and the vasculature in your eye starts to change, and it can lead to blindness. Cardiovascular problems because of the sugar over here doing this stuff and because of the increased fats that you're breaking down. And by the way, your kidneys have to process all this. It's hard on the kidneys. Commonly, diabetics eventually have to get dialysis, maybe even a kidney transplant, and that can lead to kidney failure. So, big difference between the big bad symptoms and the not so big bad ones. I will probably ask you some kind of essay on diabetes. What's that stand for? Atrial natriuretic hormone. Also called polypeptide sometimes, because what kind of hormone? A non-steroid hormone. What's atria mean? Actually, it means this. A chamber of the heart, the top two chambers of the heart are called atria. That's different than the arteries, okay? Top chambers of the heart. Then you have this word, which I'll spell. Natriuretic. Oh my goodness, what could uretic refer to? Urine. So there's this stuff called sodium that we abbreviate Na, right? Natrium is the Latin word for sodium. That's why it's on the periodic chart as Na. Therefore, this hormone means something to do with the heart causes sodium to move into the urine. Its name tells you exactly what it does. It increases sodium in the urine. Awesome. Increases sodium in the urine. What do we know follows sodium? So it increases the H2O leaving your body, right? Meaning it causes increase in urinary production. What does this do when you increase urinary production? Lower the blood volume, which lowers the blood pressure. Here's how it works. When your blood pressure is elevated, remember, most hormones are negative feedback. See, more blood returns to the atria. It stretches the atria out. And when the atria is stretched, it releases this hormone. The heart releases that hormone. It travels where? Travels through the blood and goes everywhere. And it targets what? The kidney. And it tells them to make more urine because the sodium goes there and water follows. That is brilliant negative feedback, right? We have high blood pressure. It stretches the atria. The result is this right here. That is great negative feedback. You know how I do things. You're getting the hang of it. Name the two antagonists. Perfect. This is a great mental hook. A and H sounds like ADH. That's an opposite. And it's pure, a complete, total, pure antagonist to aldosterone. Because remember, aldosterone causes sodium to go where? Into your blood. A and H does the opposite. That increase the volume and increase the blood pressure. And ADH just simply increased BV and BP. Nothing to do with sodium. That's just a review of ADH and aldosterone. You're supposed to have those already. Okay? But if you don't, I put the information there as well. Pretty cool hormones. You have now completed the endocrine system. Thank you for your patience.